Welcome to Unit 7, Medical Law and Ethics. In this unit, we will cover health information in medical research. Behavioral objectives for this unit. Identify the stakeholders in medical research. Describe federal law governing the use of health information in medical research. Summarize industry codes, ethical obligations, and guidance on the use of health information in medical research. Describe federal law, the HIPAA privacy rule requirements, and state laws with respect to the use of health information in medical research. You should also be able to describe international law affecting medical records and clinical trials. Some important terms that you need to know. Stakeholders. Stakeholders are those persons or groups who have a stake or interest or investment in the outcomes of a project. They may also be those individuals who will be affected by the outcomes of a project. Researchers. Those who conduct the research. Generally speaking, they are a scientist with a degree in the field that is being investigated. Investigators. Another term for researcher. These terms are used interchangeably. IRB, or Institutional Review Board, may also be called a privacy board. The committee that is set up to review, approve, and monitor biomedical and behavioral research with human subjects. The goal is to protect the rights of participants in research. When conducting medical research, the trial records are generated under the same laws that govern general medical records. A clinical trial is the research that is conducted. The protection of the privacy of the information generated in a clinical trial is governed by federal, state, and local laws, as well as international laws. An infrastructure that ensures privacy in the collection, storage, formulation, and accounting is required. The use of the same information in secondary research is also governed by the same laws. Stakeholders in clinical trial medical records are the following: the researchers themselves, healthcare providers and institutions, universities, funding sources, privacy boards, vendors, and support organizations for the clinical trial. The use of human subjects in research has a long and somewhat troubled history. During World War II, there were experiments on human subjects by the Nazi regime in Germany that resulted in the Nuremberg trials and then the Nuremberg Code. More recently, in the United States, the Tuskegee syphilis study experiment, or Public Health Service syphilis study, was conducted between 1932 and 1972 in Tuskegee, Alabama. The study used the participants in a way that did not adhere to ethical standards, allowing the participants to believe that they were being treated for syphilis when they were, in fact, not. This study led to the 1979 Belmont Report, which led to federal laws and regulations requiring IRBs, or institutional review boards. Henrietta Lacks was an African-American woman whose cells from a cancerous tumor have created an immortal cell line for medical research. She never gave her consent, nor was informed that her cells were being used. This has led to stricter rules in the use of cellular tissue from patients. In order to protect confidentiality in medical research, the participant is guaranteed anonymity. Full disclosure of the research method and usual or unusual outcomes is required to protect the human research subject from harm. The federal policy for the protection of human subjects provides guidelines for federally funded projects only. The federal government designed the policy with enough broadness to ensure its application in multiple settings. The policy is generally called the Common Rule. The concept of informed consent in protecting the rights of individuals has a long history. The focus, initially, was on the protection of those who participated in medical research. From this focus, the attention then began to move to the rights of the patient in medical treatment, and therefore the patient's Bill of Rights. In medical research, the following must be in the informed consent that the participant signs. There should be a statement that the study is in fact research. There should also be an explanation of the purposes of the study, the expected duration of the subject's participation in the study, a description of the procedures to be followed, and identification of any procedures that are experimental in nature. The informed consent must also contain a description of foreseeable risks or discomforts that the participant may experience, a description of the benefits to the participant to engage in this particular clinical trial, a disclosure of appropriate alternative procedures or courses of treatment that might be advantageous to the participant, a statement of confidentiality. As well, the informed consent must also contain a statement if the research has more than minimal risks, an explanation of any compensation available, treatment modalities if injury occurs as a result of the clinical trial, whom to contact for answers to questions the participant may have. Voluntary participation also carries with it the ability to have no penalty to refuse, or that the participant is able to withdraw at any time during the clinical trial. Informed consent may be waived if there is minimal risk to the participant and that confidentiality breach is only risk. The FDA, the Food and Drug Administration, regulations apply to any experiment that involves the test article. Now, a test article might be a drug or a medical device that is being tested in a clinical trial, and in which one or more human subjects, where the data are submitted and intended to be submitted to the Food and Drug Administration. In this scenario, informed consent is required except in emergency situations. All FDA regulations follow the common rule. The HIPAA privacy rule related to medical research states the PHI, personal or protected health information, may be accessed, used, and disclosed if there is valid authorization from the participant or subject. The PHI may also be disclosed with a waiver from the IRB or Privacy Board, or if the use or disclosure is one of the exceptions in informed consent. The research entity must maintain the authorizations for a minimum of 6 years. The research authorizations must also meet the common rule and FDA regulations. The HIPAA privacy rule also states that when using the exemption waiver, it should be absolutely limited to the minimum necessary. The exemption waiver may not be available for sensitive information that should not be disclosed. HIPAA does not apply to educational records or student health records covered by FERPA. Those records may be used or disclosed for research purposes without an IRB waiver. Generally speaking, university or school health services are not covered entities. Summary of de-identified information and limited data sets. HIPAA applies to all research. Primary, which is the initial study, and secondary, which is use of data for another purpose from a primary study. Secondary research is considered new research for the purposes of the privacy and security rules. Secondary use of PHI is only allowed for de-identified information or for use in limited data sets. Documentation of compliance is required, and sensitive information is prohibited from being accessed. Certificates of confidentiality. Certificates of confidentiality are issued by the National Institutes of Health. They are granted for studies that collect PHI that would be harmful to the participants in the study if the information were to be disclosed. The certificate allows investigators to refuse disclosure in civil, criminal, administrative, legislative, or other proceedings. The DHHS can compel disclosure for audits if the study is federally funded.